The Korea Foundation for International Healthcare, known as KOFIH, is an international agency under the Ministry of Health and Welfare in the Republic of South Korea. The foundation runs the Dr. Jong-wook Fellowship Program, named in honor of the 6th Director General of the World Health Organization, through which health professionals from around the world are invited for specialized training and exchange programs.
This program basically embrace and invite the healthcare professional of the partner countries like Uganda to Korea for the invitational training in the clinical course or the biomedical engineering and health policy and many more. We've been supporting our partner countries including Uganda to achieve the universal health coverage in this country. So we've been supporting the project in emergency medical service and also community health workers and also the cervical cancer screening and the infectious disease surveillance and responding and detect project and many more.
Dr. Jong-wook Fellowship Program definitely aims to build capacities of our healthcare personnel in low and middle income countries through a comprehensive training and education. I think initially the year when we began were less than 10, but now this has grown to over 20 fellows each year. So the program has grown. And I was closely sitting near the country director, and I was saying that we need to expand more and we need to be able to see that we do that.
At the annual General Assembly, KOFIH alumni gathered to share the impact of implemented programs and to elect new leadership.
We have so far taken about 150 health workers from Uganda to South Korea to undertake different programs. And for the master's programs, we have taken so far, we took 2 last year, and this year we've taken 4 candidates for the master's program, who will be coming back to Uganda in 2027.
This year's assembly announced a funding award of $65,000 for the upcoming 2025 KGA projects, a boost aimed at advancing healthcare innovations and community health interventions.
We got a funding award of $65,000 for 2025 KGA alumni projects. We also got to hear from implementers of previous KGA projects about their challenges and their experiences during the panel discussion, together with the Ministry of Health, who contribute greatly to our work. But then we also got to elect our new leaders.
So far, 7 projects have been successfully implemented by KOFIH alumni, including Uganda's own Trauma Assessment and Treatment Algorithm project known as TUTATA, a homegrown initiative designed to improve emergency response and trauma care systems.
In this project, the focus was on capacity building for emergency medical services and also procurement of equipment. These projects have been scaled up nationally, so we currently have over 40 trainers who have undertaken this course, and they're now able to provide this training and disseminate this knowledge to other health workers who may not have access or who may not be within Masaka, where the concept was developed from. Because our interest is to make sure that we have projects that are scalable, projects that are impactful, and projects that provide value for money. And that is how we select the new projects that are implemented under the KGA.
The newly elected president of the KOFIH Alumni Association acknowledged a major challenge, the institutionalization of KGA projects, to ensure sustainability and long-term impact.
I will take it upon myself to coordinate, especially with the key stakeholders, that is the Ministry of Health, with the various departments within the ministry, so that they can be able to own most of these activities. For example, for TUTATA, the Uganda Trauma Assessment and Treatment Algorithm, the EMS department is going to take ownership of it, and for us, the technical people, will now be able to enroll, get out there and train all the health workers in Uganda, so that we can cut preventable deaths from trauma from the current 60% to less than 10% by 2040.
The Korea Foundation for International Healthcare continues to strengthen its partnership with Uganda and other nations, empowering professionals and transforming health systems through knowledge, innovation, and collaboration.